Hi there everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is a compilation video of a couple of clients who attended with fully occluding and blocked earwax in the right ears. So this is patient A, and patient A actually wears insert earphones as part of their work duties, and they suspect that it's because of the wearing of the insert that's led to their wax impaction. Previously, they've never suffered from earwax, and they were experiencing severe otalgia, earache, and you'll see why in a moment. This plug of wax, you can see I'm just trying to gently wriggle it out of the ear. It extends all the way to the eardrum, and you'll see the eardrum's a bit bruised, if you like, or the back ear canal, should I say, is a bit bruised. The eardrum is slightly red as well. So this is making direct contact. You can see on the left it's a bit sore there, so that's where the wax plug is pushed up against the canal. The eardrum's the handle of malleus, the hammer bone, slightly dilated, the blood vessels, and a slight attic retraction. The eardrum was slightly sucked in the roof, in the attic region. There's a still image of the plug of wax. Yeah, just how dark it is. It's been there for a while. So it just measured in between 15 and 20 mil. Now, this is actually patient B's left ear, and there's no wax. There is a bit of wax at the entrance, which I'll remove later, but you could just see their ear there. They had glue ear, otitis media with effusion. They've had a history of that, and you'll see it again a bit later on in the video. And also they've got glue ear in the right side. This is their right ear, but the left ear was much more severe case. So glue ear is a buildup of catarrh fluid behind the eardrum due to a blocked eustachian tube, which is a tube that connects the middle ear, which should be full of air, to the back of the nose. And the eustachian tube typically gets blocked at the back of the nose. And the function of the eustachian tube is twofold. It's the pressure equalizer in the ear. We want the air pressure behind the eardrum to be the same as the air pressure in the atmosphere. And it's the job of the eustachian tube to equalise the air pressure. So every time we yawn or swallow or chew, it momentarily opens and equalises the air pressure. And it's also a drain pipe. So any fluid that is secreted in the middle ear, it drains out of that eustachian tube. But if it's blocked, it'll build up. That fluid eventually will get infected or become viscous, very thick and glue type, hence the name. And it leads to a build-up of fluid behind the ear as opposed to it being air-filled, which then affects your hearing. The patient's previously had grommets, but we've given some over-the-counter treatments for their glue ear, and we've also referred to an ENT because they're mainly grommets or some other treatments. So in the right ear, it's really, really dense wax. I remember saying that to the patient, the wax is quite dense because it blocked the tube, and I was explaining the reason for it. So I'll explain then, I'm going to put some olive oil just to loosen this wax a bit, lubricate the suction tube to bind the wax together. You can see it's lodged really deep here. I'm just bringing it out. Where it's lodged, it's half a centimetre away from the eardrum in a region called the isthmus. So the ear canal, as it approaches the eardrum, it narrows about a half a centimetre away, and it protrudes back out again. And that thinning, that narrowing is called the isthmus. And this wax was lodged beyond that. You can probably saw there, I went really deep to bring that out. To manage to clear that. And similarly, this patient was also, you can see the eardrum's a bit red. The attic is retracted, but the back part to the left of the eardrum is actually bulging. It's coming outwards, whereas the front part of the eardrum is also a bit sucked in. So there is a bit of fluid there as well. We confirmed that. We did a pressure test. So we pumped some air into the ear. We changed the pressure. We played a sound as well. And we're just measuring how much of that sound is reflected back out the ear. The more sound that's reflected back out the ear, it means that the eardrum's not very compliant, it's not very mobile. The sound's hitting the eardrum and being reflected back out, as opposed to the sound being absorbed, admitted into the ear. So we do a pressure test, and it then allows us to ascertain how mobile the middle ear is. And if there's fluid behind the eardrum in the middle ear, then the eardrum is not going to be very mobile, very compliant. And it was a case in both sides that they had glue ear. So we recommended some nasal decongestion sprays, the Otovent nasal balloon. We've also discussed the ear popper if they wish to try that. And because they've previously had grommets, we've referred back to ENT. It could be that they need permanent grommets, which are called T-tubes. There is other treatments available, possibly eustachian tube balloon dilation, and that's when a balloon is inserted under general anaesthetic up the nose, up the eustachian tube opening, and a balloon is inserted into the eustachian tube and it's dilated. It's saline water is pumped into the balloon for about 20 seconds. And the concept is if you've got an anatomically narrow eustachian tube, this helps to stretch it open, so it's more likely to open naturally when you open and close your jaw, swallow, eat and chew, so the pressure can equalise itself. But obviously that will be an ENT decision because they've previously had grommets as well, so they might go down that route. And this is the left ear. You can see the reason why I'm actually showing you this, it's just to see if you can see the eardrum again. And so this is just surface wax. It's actually not going to cause them any problems. And I'm just using a Jobson horn, just slowly. I'm not going to try and get every little last speck out. I just wanted to get, just going to hover over and just the big wet lumps. If it comes out, brilliant, but we don't want to graze the canal wall or bruise it. I think I'm just going to use the fine end suction probe here just to hover over, and hopefully again you'll see the eardrum in a moment. It's actually a bit of dead skin. There we are. And then that's about it. We're not really anymore. And we're going to go back in. You'll see the eardrum. This one, it's a bit yellowy as well behind the eardrum. So it's called middle ear effusion. And here's a still image of the left ear again. So if you want a close-up view, you'll see that the eardrum's very... it's in the attic, the top part, it's sucked inwards. It's retracted. And you can, if you look really closely, you can actually see the effusion. It's a yellowy substance behind the eardrum, which is also inflamed. It's slightly red and dull. Well, I hope you enjoyed that video, guys. Take care, keep well, and I shall speak to you soon. And remember to be kind and nice to each other. Bye.